So sinusitis is something lot of people struggle with, especially the constant headache and nasal congestion.
Has become one of the most common complaints. Ayurveda has become very palatable nowadays.
Is there any lifestyle changes that people have to follow?
The sleep cycle plays a big role in your immunity. Yeah.
Is there any immunization in Ayurveda? Autism and ADHD impact in today's world of children?
I have patients coming in for both in India and outside India. Is ADHD. Dengue is one of the most vicious types of fevers that one can incur. When people approach other systems of medicine when there is a gallbladder stone, cholelithiasis. Disc bulge, it is generally called as a slip disc.
Welcome to LiveRight Ayurveda. I'm Dr. Gayatri. In today's podcast, we have Dr. Bharath sir with us. Sir is a third generation Ayurvedic doctor with 16 years of clinical experience and 9 years of teaching experience. Sir is specialized in spine problems, fertility issues, skin disorders like psoriasis, joint pains, and lifestyle conditions like diabetes and thyroid problems. His clinic has even achieved remarkable results like reducing a benign brain tumor and curing dengue cases. Sir, we are so glad to have you with us. Welcome, sir.
Thank you, Dr. Gayatri. It's indeed a great pleasure to be here and create content for all the Ayurvedic doctors and all the general public alike.
Sir, sinusitis is something lot of people struggle with, especially the constant headache and nasal congestion. So, in Ayurvedic perspective, how can treat them and help the people to get a relief?
Sinusitis in today's world has become one of the most common complaints. Even a small child with the age of 4, 5, 6, people have started getting sinusitis problems nowadays. So, especially with the winter now, the rainy season that we are facing, this problem seems to be a lot more. Sometimes this is coupled with the flu, the fever and all that, with the cough and cold. But majorly, when you say sinusitis, you have nasal congestion, you have nasal septal deviation, septal thickening, inferior turbinate thickening, sometimes nasal polyps, and the maxillary and the frontal sinuses getting swollen up because of the collection of fluid inside. So Ayurveda looks at this as penasa, or when it is a chronic sinusitis, Ayurveda looks at it as a dushta penasa. We have amazing remedies which can help you from the day one. What we'll have, and Ayurveda has become very palatable nowadays. We have capsules, we have tablets. People still think about kashayam when it comes to Ayurveda. We have medicines like Arka, where a distillation process is used to create the medicine or manufacture the medicine. So these medicines have become very highly palatable nowadays that even a small child from the age of, even from the day it is born, the child can be given very safe medicines. There are lots of myths revolving around Ayurvedic medicines creating kidney injuries and liver injury, the liver complications and all that. All the LFTs and RFTs flying through the roof because of Ayurveda. Nothing has happened like that in my practice for the past 16 years. If you practice safe medicines from good companies, or if you can prepare your own medicines with GMP, good manufacturing practices, then it is never a problem. And sinusitis, usually, especially chronic sinusitis, in our clinic, I think we've cured thousands of cases, and we also help them in making sure that it doesn't come back. Okay, so sinusitis will also have other repercussions, like other than only affecting the upper respiratory tract. In the long run, it can affect when you are having severe headache. Sometimes this changes into a migraine. Sometimes it can be a cluster headache. Sometimes chronic sinusitis can also lead to ear-related infections. Then there is a tonsillitis that is involved. All these are very, very much curable in Ayurveda. So yes, sinusitis is a place where Ayurveda can be used right, left, and center.
So when you're talking, you said that there is no recurrence. For no recurrence, is there any lifestyle changes that people have to follow?
Yeah, yes. See, all these sinusitis-related issues, or many other issues for that matter of fact, are results of our bad lifestyle, for that matter of fact. So When you're talking about sinusitis, obviously people know that you cannot, when you're especially suffering from sinusitis, which is a recurrent one, you cannot have cold items. You cannot get exposed to cold air. Your sleeping cycle has to be extremely good. That is, go to bed in time. I'm not saying you have to go to bed by 7 o'clock in the evening or 9 o'clock in the evening or 10 o'clock in the night. That is not what I'm trying to say here. Go to bed the same time daily. Come what may. It can be a Monday or a Saturday night. You should go to your bed at the same time. Wake up in the same time. Okay. If you're waking up, I don't say again wake up by 4 o'clock. Okay. Although it's very good to do that, but even if you want to wake up by 7:30 in the morning, 8 o'clock in the morning, you set that time. It is a commitment that you give to yourself, and at least keep waking up at the same time daily. If not daily, at least 9 out of 10 days, 90% of the time. See, everybody has some of the other commitments. Sometimes I might want to go for a late night dinner. I might have to go with my friends outside. I would have to take my wife for a late night dinner. We might be traveling. Things will affect our sleep. So I'm asking you to do it 9 out of 10 days. Make sure that you go to bed and wake up at the same time. Come what may. It can be a Sunday or Monday. You have to wake up at the same time. The sleep cycle plays a big role in your immunity. So if you get exposed to other things like the allergens also, that can also create a problem. So it will be a very tailor-made lifestyle for each person. For example, I know people who drink tea and start getting severe sneezing. People have been known to get allergies from dust, smoke, smell. Even a sharp smell can trigger severe headache. Some people have a good amount of relevance with relationship with gastritis. When a severe gastritis develops, they get an acid splash in the throat, and then a sore throat develops. This sore throat becomes a cough, then it becomes a phlegm, then slowly it becomes a sinusitis at last. So that is, they develop a flu or a fever. This is a multiple pathway which are coming together. Ear, nose, and throat are connected. So the infection can pass from one place to another very fast. So it doesn't matter from where it starts. So avoid allergens. This will be very, very specific to each person. So avoiding allergens and avoiding all this cold exposures, like it can be liquids and solids, or getting exposed to cold air, and your sleep cycle. And one of the most important things that we don't do, most of us don't do, is having early dinner. There is a concept of intermittent fasting picking up very fast nowadays. People want to fast for 12 hours, they want to fast for 16 hours. Okay, so going to bed is as important as having your dinner early also. So even if you're a person who takes food 3 times in a day, 2 times tiffin, once a rice, if you're a South Indian or whatever it is, have your dinner by at least 3 hours before you go to sleep. If you're going to bed by 10, make sure your dinner is by 7. If you're going to bed by 11, make sure your dinner is completed by at least 8 o'clock. Okay? In Ayurveda, we say that the kapha phase of the digestion is the first one. It has to get finished. Only then you go to bed. So most people ask, should I go empty stomach to bed? It is not empty stomach. Usually when you have to train your stomach in such a way, your gut in such a way that you have food, have maybe water after that if it is needed, then go to bed by at least 3 hours after your meal. If you have a heavy meal in the night, late night, and go to sleep immediately, you are very, very prone to getting sinusitis and other kapha-related problems.
Okay, we can tell these precautions or lifestyle changes to adults and make them understand. But in the case of children, what can we do, sir?
Very interestingly, children are more malleable. They are more actually people who can be
more prone to these symptoms.
No, I'm saying they are very much prone to these symptoms because their immunity is still developing. You will see a lot of children getting wheezing attacks and all this kapha-related sinusitis attacks and all that. But as they develop their immunity with age, they become better. For that, Ayurveda can give a great support. I'm slightly digressing here to wheezing also. Some people say that if you don't treat wheezing till the age of 12, they get better. This is not the case in all the cases. But it is true in all the cases, if you treat the wheezing early, their immunity comes up very fast and they get rid of the wheezing till the age of 12 also and after the age of 12 also. So, what is the point of making the child suffer with wheezing till the age of 12? So, coming back to your point, children are more susceptible to these kind of attacks, yes, but they are also one of the people who are very much, they are not very opinionated. Most of our Indian children, if the parents are dealing with them right, they go to bed in time, they wake up in time. They are the ones who have better lifestyle than us.
Yes.
It's usually the parents who actually give rules and they don't follow also. Okay, but so I think lifestyle, uh, there will be a problem in your this thing. Like in the last podcast when we were having a podcast with Dr. Uday, he said the child has its own rights, so you cannot push the children too much. But yes, I still feel more than elders, more than adults, children have a better sense of obeying things. They are conditioned that way.
Okay.
Right? Go to school, listen to the teacher. Go home, listen to what your parents are saying or the grandparents are saying. So they are more conditioned to it. We have a little bit of more free will, which we actually misuse. Can I say that? Can I use that word? Then, yeah.
Sir, when you're talking about the treatment of asthma, you said the word immunity. In general, people will all know the modern side of immunization.
Yeah.
Is there any immunization in Ayurveda? If there is, yes, please explain about that.
So, Ayurveda has many concepts when it comes to immunity. We call it Vyadi Kshamatva. See, when you say Kshamatva, it is the ability to withstand something, not only prevent. Okay, prevention is, of course, prevention is better than cure. It is the ability to withstand a Vyadi. So, rather than having when you say in modern immunization, you get some, if you get a virus or something, and then you can get possibly a shot for that. For example, the influenza shot is there, which every year you have to take, and you get better. You're not affected by cold much. This is not the kind of immunity that Ayurveda
Totally.
plans to or it gives you. It does two things. One is very helpful in preventive. That is, generally keep your doshas in balance by keeping, like how we were talking before, do your routine properly. From morning till night, you have your routine properly. This is one thing that you do. Along with your routine, we'll add some small medicines, single drugs. For example, some people will get ashwagandha. For some people, we might give a slightly complex medicine like talisadi. And in some cases, maybe Dashamula Katatraya. In some cases, we might give just Dashamula Arishtam. In some cases, Vasa Arishtam, which you can take continuously. But your doctor will be the best person to decide this medicine. It is like an elixir that you can take a little bit daily. And for example, nowadays, now we have a product in the market where Arkam, distillation of Haridra, turmeric, along with gooseberry, what we call Nelikai in Tamil. Both of these are mixed in a certain proportion. I think it is 1:10. That is the Nelika is more.
Okay.
Amalaki is what we call it Sanskrit. And gooseberry is more. While turmeric is one portion, the other one is around 10 portions. And a distillation of this is done. And it gives amazing results when it comes to immunity from day one. Okay. But this might not be true for everybody. Okay, this stands very true for me because I mostly get kapha pitta problems. So I can have this medicine. Another person who has a complete kapha problem can have a Dashmul Katatraya.
Yeah.
Maybe somebody else will have something else. This is one way that is highly specific, I cannot call it standardized. It should be highly subjective for each person. Okay. Then this is for personal immunity.
Okay.
Your doctor will decide. Then comes community-wise. The whole community should have a herd immunity, right? That is where Swarna Prashanam comes in. Swarna Prashanam is a very famous concept nowadays where specific drugs along with a little bit of gold's basma. Again, when I say basma, you don't have to be worried about gold ingesting metal and all that. A metal will basically have any chemistry read person knows that a metal has to have malleability, ductility, and luster All these three are very intrinsic properties of a metal. Without that, you cannot call it a metal. A bhaspam is an ash. It is an oxide of the metal. So when you say iron oxide, ferrous oxide, okay, when you say iron oxide, it is not iron anymore.
Yes.
Right?
Yeah.
So when people say there is metallic medicine in that, it's not exactly metal in that. It is like preparing a dish. You might have 5 different ingredients. At the end of it, it is a new dish, right? So extreme processes are done to create this gold bhasma, and it is added in so fine amounts, very small amounts, and it uh, kindles the immunity of the person when it is taken along with the ghee, along with honey, or whatever anupam your doctor asks you to have. And we have had patients who have had this Swarnaprashanam or even gold Basma based medicine daily for a period of 16 years. We have data for that in a single person. And we also have a big data, that is when I call big data, this is not a computer's big data. Numerous patients who have had Swarnaprashanam and have had no problem whatsoever with their liver function tests or kidney function tests. Even when you scan, it is very normal. There is no nephrotic syndrome, there is no kidney injury, there is no liver problem.
Okay.
Their LFT is not spiked again. All these are some misconceptions in this thing. So Swarnaprashanam, I give it to my own daughters. They have it every monthly once. And when their exam approaches, I give them gold basma based medicines for a month or so when their main exam approaches. Why? Not only to improve their immunity, not only to improve their memory, not only to make them remember, that is, memory is one thing, learn faster, not only to increase their concentration levels or eye contact or cognitive ability, all these are done. One most important thing that this medicine does is reduce stress. When you're having exams, you can reduce the stress of the children by giving this medicine for the last 1 month. And the other medicine that we use is Brahmi. In Tamil, sometimes it's called Neer Brahmi. It's a different one, but Neer Brahmi is also very much used. So it is used in capsules, it is used as ghee, it is used in tablet forms, right? So there are various forms which are very palatable for the child also.
Okay.
So Swarnaprashanam is one of those medicines which increases the immunity of the child along with the cognitive ability and all that.
Okay.
So that can be considered a type of immunization from Ayurveda. It has there is no rule that you cannot have allopathic immunization along with Swarnaprashanam. Swarnaprashanam can go separately while you have your allopathic immunization also.
Okay.
Many people opt for this. There are some people who opt only for Swarnaprashanam also. It's completely the prerogative of the parent, and the doctor can advise you that properly. For example, I don't know if I can put this in the uh, public domain, but as a parent, I have taken a very conscious decision as a parent and as an Ayurvedic doctor. I have taken a very conscious decision that my children will not take any immunization or any shots as of this thing. They've never had. Maybe in the when they were born immediately, just when they came out of the hospital gave something. I have no idea because I specifically told them not to. Since then, they have been on Ayurvedic medicines, and my mother was a great homeopathic doctor. They have been on some homeopathic medicines also. I have never had any shots for this thing except for COVID. COVID is a completely different thing. That was a completely different time when around you had so many cases coming up. I think we can talk COVID separately because you needed herd immunity at that time, and so they asked you to. That is the only vaccination that I've taken in my life. And before in my mother's time and all in 1960s, I don't think vaccination picked up so much as it has picked up today. So since 3 generations, you can say that we are vaccination free.
Okay.
Okay. So yes, and we are very hale and healthy also. So you can. I'm saying there is an alternate route when it comes to immunization of children, and Swarnaprashanam plays a big role in that.
So when you are talking about Swarnaprashanam, you said two words like cognitive ability and eye contact, stress
Yes.
reducing, like that. So I just want to know about the autism and ADHD impact in today's world of children, and I want to know about how Ayurveda can help that in conditions.
In those conditions. Great. Pediatric cases in Ayurveda are increasing day by day. Uh, uh, we had Dr. Uday again in the last podcast talking about, especially about pediatrics in Ayurveda. We in our clinic also, in LiveRight Ayurveda clinic and in my other clinic also, we have a lot of pediatric patients who come in. We talked about immunity before, for immunity based problems, for fevers, for dengue, for many other things people come in. One most important thing that I have patients coming in for both in India and outside India is ADHD, that is attention deficit and hyperactivity disorder. And the other one is autism or ASD, where there is a spectrum of problems. So basically, one thing is that we'll talk about ADHD, where the child has attention deficit. It cannot sit in one place. The child cannot sit in one place for a long time. They will not be able to concentrate on one job for a long time. Sitting tolerance is what you call it. There is no sitting tolerance. There is no enough eye contact for the child, and they are children are made to be very active. That is very much okay. Many parents who have a ADHD child and then they get a second child, or their second child, they find out it to be having ADHD, they start worrying about the other child having ADHD even when the child is normal.
Okay.
A child is going to throw temper tantrums. A child is going to cry at times, maybe more than what you like. So, or maybe other things which can be related to as a symptom of ADHD. Sometimes a child can become very hyper. But you have to understand what is normal and what is abnormal, right? For that, you need a doctor's advice. Definitely, you need a doctor's advice. What I'm trying to say is, don't be too worried if you have a second child. Sometimes it may be, not sometimes, 99% of the times, the child is normal, the second child is also normal.
Okay.
So, that is one thing I wanted to say. And when it comes to ADHD, Gold Basma plays a great role. Other than this, obviously, this podcast is not for prescribing medicines.
Okay.
This is for a discussion for people to understand. You can make it a disclaimer if you want. But when they go to an Ayurvedic doctor, he will be able to prescribe medicines. We use Smriti Sagararas when there is memory problems, and then we use other medicines like Brahmi, what we talked about before, or Neer Brahmi. Then there is Sankapushpi that we use. These medicines help the child first to basically calm down and come to our reality and start doing these things. So the hyperactivity is reduced. Once the hyperactivity is reduced, the child knows how to concentrate, and the symptoms are they get very better with a very short period of time, maybe within 2-3 months. But the child might need a longer period of treatment. That being said, not only medicines. Other than medicines, we use a lot of Panchakarma in all our clinics, like how in this clinic also, in LiveRight. We have Panchakarma facilities. Panchakarma facility is one of the most important facilities that an Ayurvedic doctor can have. Rather than just prescribing medicines orally, there are cleansing methods, there are curing methods. In this ADHD, there are calming methods where only external therapies are being used. For example, Takradara,
Yes.
only external. Tailadara, only external. Shirodara, where oil is put only on the head slowly. All these are external techniques that you can do only in a clinic setup, but at the same time, they are extremely useful. Extremely useful. So much so that immediately after a 7-8 days stretch of Panchkarma, in what we call as the Parihara Kala, in the next 16 days, that is twice the amount of number of days that you have used for the treatment. If it is an 8 days treatment, then the next 16 days also have the same curing effect as the 8 days. It slowly weans down, but then it has the same effect. The effect is the same. The intensity of the effect keeps weaning down. So once this effect wanes out after 16 days, it's not that the child falls back to its square one. No, it is like a lift. For example, you want to climb 100 floors and you have a lift for 40-50 floors. You better use it.
Yeah.
Panchakarma is that lift which can improve your child's ADHD problems and improve not the problems. It can make sure that the symptoms are mitigated faster rather than giving only oral medication. So, other than ADHD, next we can move on to ASD. autism spectrum disorder, where again children have a lot of problem with communication. That is, they have a different mindset, they have a different way of thinking, of expressing. It might not be what you and I have. These children have, and many children with ASD and ADHD combined, they have uh, problems with the speech, problems with cognitive problems. It can be other, sometimes even motor skills are also affected in some children, coupled with this problem. That is, a fine motor skill can be a problem, gross motor skill can be a problem. All these problems are addressed extremely well with Ayurveda when you go with internal medication and Panchakarma. And amazing results are seen. My ADHD and autism uh, patients vary from the age of sometimes even 3, 4, as young as 3, 4 years old to 23 years old. My recent patient is a 23-year-old patient from Australia. So we also, we also do a lot of online consultations, and it's very helpful because not always people can travel back to India and get these treatments done. But at least the internal medications can be given over there. Whenever they travel to India, they get their Panchakarma done. So it's like a medical tourism in Ayurveda perspective. So very useful, yeah. So in ADHD and autism, when all these symptoms are very easily mitigated when you use Ayurveda. Not only occupational therapy, not only the other therapies that you speech therapy and all that you use. Not only that, Ayurveda speeds up the process of making these children better, giving them a better quality of life is the idea of using Ayurveda.
Okay. Sir, can you explain the Panchakarma part more elaborately? Other than Takratara and Shirodhara, any other procedures are there?
In ADHD and autism?
Yes, sir.
For children, yeah. Shirodhara and Takradhara are one of the main things that we use, like how I told you. Takradhara, I'll just give an introduction of what is Takradhara and Shirodhara. Takradhara is medicated or medicine added buttermilk is poured all around the body, for all over the body, and except for the head sometimes. Sometimes we do Takradhara of the head also. When we do this, both the central nervous system and the peripheral nervous system calms down. The child's sometimes the child has a flapping tendency, unusual finger movements, and all those things will reduce. The hyperactivity will reduce. The child becomes more calm, well centered, and all that. There is a Tailadhara. Tailadhara is Dara means pouring something. So when you do Tailadhara, the same thing happens. That is, you can pour Dara, Taila, or oil all over the body, slowly. It is done in a specific way. Okay, there are techniques to do that. There are specific Kerala techniques. There are other types of authentic techniques like Kerala technique also. Then there is Shirodhara. Shirodhara is pouring medicated oil only on the forehead. So what happens when you pour it on the forehead and there is a small cloth tied over here so that it doesn't fall onto your eyes? What happens is it slowly goes through the whole scalp. What happens is the child becomes very calm and the central nervous system is very, very, very calm after this treatment. And a lot of IT people undergo this treatment in our clinic because they are severely stressed out and they want some kind of relief from that. People who have sleep disturbances, people who have a lot of stress disorders, people who have a lot of depression and other bipolar problems, they also use. But I'm digressing again, I'll come back to this. So other than this Takradhara and Tailadhara and Shirodhara, we have Shiro Abhyangam. Shiro Abhyangam is where oil is put on the head and a mild massage, not a very hard one because it's a child that we are treating. Mild massage is given for 15-20 minutes and then allowed it to be soaked, then wash it with warm water. Then there is Shiro Vasti, where kind of a chef's cap is kept on the child, and inside that, warm oil is allowed to stay inside. Again, all these techniques are to calm the central nervous system. Someone might ask, what will happen when you pour a warm liquid outside the head? How can it affect something inside this thing? So
it's not only for Shiro Vasti, it's for Abhyangam also.
Exactly. What happens is your nerves, for example, when I ask you, your nerves are coursing through all over your body. When you touch here, how do you understand that a nerve? It is because of the nerve that you're able to understand. An external touch actually sends impulses to your brain and then it gives you the idea that someone is touching or something is touching or it is cold or hot or whatever. The same way when this oil touches you, it has a different experience. The nerve has a calming effect. This much, if general public can understand it, is more than enough. So this is one thing. Other than this, we have nasyam. In Ayurveda, we say nasahi shiraso dwaram. That is, if you want to reach to the head, to the brain, the nose is the nearest point of route. And we give this is
It is
true.
like gateway of.
Yeah, this is true in brain surgery also. A lot of brain surgeries are done through the nose. Okay, instead of opening the skull. Nowadays, even through the nose, a lot of brain surgeries are done. And then when you put medicine through the nose here, nasyam is a technique which can actually help the eyes, nose, ears, throat, and also the brain. And there are different doses that you can give according to which place you're treating. The dose of the nasyam will also differ. So, other than this, we also give abhyangam. Abhyangam is giving a massage. This can be done at your home also. You can just take oils like Himasagara Tailam or Dhanvantra Tailam, whatever your doctor prefers, whatever your doctor prescribes. And you can give a gentle massage of the whole body daily to the child. 2 to 3 minutes of massage just before taking a warm water bath. That gives a tremendous effect in the long run. And a good massage with Dhanvantra Tailam and Sachiradi Tailam, full body massage, helps many children who have enuresis, bedwetting complaints in children. So it actually strengthens and calms the nervous system. These are general panchakarmas that we use. Other than this, in some children we use basti also. Basti is enema. Enema is one of the most powerful and at the same time with not many side effects. It is a treatment that can be used vastly in areas of ADHD, autism, and other places.
Sir, when we are talking about immunity and fever like that, you told that dengue can be treated by Ayurveda. Can you tell me more information about that?
Dengue is one of the most vicious types of fevers that one can incur. I've always been treating dengue for quite a long time now.
Okay.
But one of my most important and very close to the heart, if I can call it, experience was when my first daughter was 2 years old. She got dengue. And what happened was, she was responding to none of the medicines that we were giving. It happens. It happens with Ayurveda, it happens with homeopathy, allopathy. We hear cases that in hospitals people don't respond for antibiotics. It happens with everybody. So there was a time, a crisis, when I had to think about my daughter's life also, because the platelet counts go down every single day, and it can lead to thrombocytopenia, which can lead to internal bleeding. And she is 2 years old, and my whole family is putting their can I call it their confidence on me. Okay, and I have to treat my 2-year-old. It's a very emotional decision that you have to take. Usually, when patients come to you, it is not as emotional as treating your 2-year-old daughter. Okay, so what happened was I had to find something new there. So I went back to the basics. Whenever I have any doubts, when I'm stuck in a dead end, I usually go back to the basics, what we call in Ayurveda the Sutrasthanam and the Nidhanasthanam. So I was reading Jwara again, and this was typically a Pittaja Jwara with Tikshna Vega, severe high grade fever, 103, 104, okay, and severely dehydrated child. She was just lying around like that, not opening her eyes properly. She was literally dehydrated and going into that stage. What struck to me was to give an anti-pitta medicine, if I can call it that way. So it has to be a highly bitter medicine, okay, and it has to be something that helps in generation of blood cells like platelets and other things also, which means it has to support your liver and spleen. So modern medicines, whatever anatomy and physiology we have, it is good to have this idea about what is happening in the body, other than knowing Ayurvedic biology also. So I chose Patola Katka Rohinyadi Kashayam, which is not very usually used in dengue. So I gave her a medicine dose of around 3.5 ml or something. and we gave her 3 times. After the first dose, 45th minute, not joking, 45th minute, the child started playing.
Okay.
No paracetamol. I'm not against any systems of medicine, but till today, in my experience, whatever dengue patients have told me, no other medicine could have done this to the child. And the child started playing in the 45th minute, and after that, it didn't look like she had dengue for the next 1 week. We made her take leave from her. She had a little bit, she was less in her strength, stamina, in her this thing and all. That was okay, but it didn't look like she was having dengue. That is when I rigorously, very seriously started treating even serious cases of dengue. When the recent case, she was around 30, 34 years old, and she had severe dengue. And when she approached us, her platelet levels were around 40,000. Below 30,000 is very severe. And the second day only she could procure medicines from us. It was below 30 the second day.
Oh.
And the patient wanted to stay with Ayurveda. Okay, that is the amount of awakening that's happening nowadays. And we put her on medicines and we kept checking her platelet levels and other things that we had to do. And it was an amazing recovery. Within the next 3 days, on the third day, actually the patient recovered superbly. So Ayurveda has a great support system when it comes to, as a primary health care, when it comes to dengue. Ayurveda can be a standalone treatment when it comes to dengue. You don't have to use antibiotics. You don't have to use antibiotics. I mean, in viral infections, you don't use antibiotics unless you have some other infection which is cropping up and all that. But still, Ayurveda can be that one thing that can be your cure when it comes to dengue, and a very fast one at that.
Sir, you have said you gave the medicine which were helpful for liver. Is there any medicines or treatments which is available in Ayurveda for gallbladder stones or polyps?
Yeah, very interesting question actually. Most of the times when people approach other systems of medicine, when there is a gallbladder stone, cholelithiasis, or when there is a gallbladder polyp, most of the times it is a surgery that is advised in other systems of medicine. To a certain size, till a certain size. For example, we treat till the size of 10 millimeters.
Okay.
Okay, and there are other things which will come into play. That is, it should not be a mobile stone. If it is a mobile stone, we tell the patient it will get cured, but in between, if it goes and obstructs the common bile duct, the CBD, and if you get into severe pain and obstructive jaundice, you might have to go for a surgery. Just keep the patient informed. Okay, because when a person comes for Ayurveda, they come for Ayurveda. Okay, they cannot be half-hearted Ayurveda and allopathic this thing. They cannot do that. So you tell them your constraints. But when it is an immobile stone, even if it is still 10 millimeter, it is very easy because it's going to take a long time. But the chances of the patient going into having severe obstructive jaundice and severe pain and that becoming escalating into a surgical condition are very less. So if you ask, have you treated gallbladder stone patients? Then yes, almost daily. We have patients coming in with gallbladder stones almost every day. Yesterday we had a 37, 38-year-old lady who came in with a gallbladder polyp. A polyp is generally not a stone. Okay, a stone is, even though when we call a stone in gallbladder, it is actually 90% of the stones are made up of fat. Okay, some are calcium stones, some are fat stones. So they just get dried up and they settle over there. So the medicines that we give will slowly, if I can call it dissolve, okay, slowly it will reduce it in size, and there has been complete remission also. That is we have scans before and after, even till the sizes of 10 millimeter, it is curable in Ayurveda. Of course, like in any other condition, you need lifestyle changes and you need medicines. When I say lifestyle changes, the person has to exercise properly, go to bed in time, try and avoid outside food as much as possible. Like we talked for the other thing about the sleeping cycle, your junk also and other having the food that you like also should be 90-10. 90% of healthy food, 10% here and there will still not affect the treatment too much. If you can cut down more, obviously your results are going to be faster. Okay, that is definitely there. But what I'm trying to say is you don't have to compromise too much with your lifestyle in order to stay healthy and get cured of gallbladder stones. Same thing with gallbladder polyp. When the polyp here, it is not a tissue, it is like for understanding of the public, I'm saying a pimple. Okay, it's not exactly a pimple. A growth like a pimple inside this thing where it is having a fat. Sometimes it can be a singular one. Sometimes it can be a multiple one. Again, this is treated with extreme success in Ayurveda, but time. One problem is the patient has to be perseverant enough to take medicines for 6 months, 1 year, in some cases even 2 years. But what you're avoiding is a surgery, right? So if that is what is important for you, if that is your priority, you want to avoid a major surgery and at the same time not have lifelong gastritis problems, because once the gallbladder is cut and it has been operated, once they remove it, after that you have a lifelong gastritis problem because all the bile juices are going to come and get settled in the stomach all the 24 hours. Usually what gallbladder does is it takes it inside it and then it releases it in the time when you want to digest things. Here that does not happen. No? So once it is removed, it directly comes to the stomach. So you have more susceptibility to more chances to get GERD, gastroesophageal reflux disease. Basically, you will have a regurgitation of your food, the acid will come out. In Tamil, we call it edukalikkal. Okay, so that can happen. There can be a ulcer which can form in the stomach, or there can be a duodenal ulcer. So gastritis, duodenal ulcers, these are all quite common when it comes to having a gallbladder removed later after the surgery is what I'm talking about. So you want to avoid all that. Ayurveda is the place for you to come.
Okay. So tell me about how can Ayurveda help in the disc bulges, which is the most commonest problem nowadays.
Yeah. Disc bulge is colloquially called by general people, laymen, if I can call it that. It is generally called as a slip disc, where a disc which acts as a shock absorber between two bones in the neck or in the upper back or lower back. Because of the pressure from up or down, when there is a pressure from both the sides also, this disc slowly it intrudes into the space of other tissues. Usually it hits the spinal cord slowly, okay, the covering of the spinal cord, the meninges. So this is called as a slip disc, okay. It can be a disc desiccation. Desiccation is it can get dried up because of the pressure, continuous pressure, or it can be a disc bulge where only a small amount of disc is bulged, or it can progress into a disc prolapse, protrusion, extrusion, sequestration, which means all these names are in their ascending order, in their chronological order, they are worse. Okay, more than a bulge, a prolapse is worse. More than a prolapse, a protrusion is worse, and so on. Okay. In Ayurveda, we are able to treat even sequestration of disc bulges, where the disc can come out and travel down or up, and it can put severe pressure on the spinal cord. The MRI will reveal that there is a severe indentation on the spinal cord, and even the signals from the spinal cord in between is lost because of this disc bulge. We have some extremely superb medicines and internal medicines and panchakarma again. Okay, so it can be a neck problem which is radiating to your arm. It can sometimes the patient presents with a severe shoulder pain. Yesterday I had around a 50-year-old lady who had a problem in her hip, and the pain was traversing down till her ankle. Sometimes this happens on the front side, what we call the anterior side. Sometimes on the back, posterior side. So when there is a pain is traveling in a line from the back to the toes, this is called a sciatica. The sciatic nerve comes under pressure and the disc goes and puts pressure on the exiting nerve root of the sciatica nerve. What happens is not only pain. Some people will have tingling sensation. Some people will have numbness. Some people can have burning sensation. I've even seen people having sensations of cold. That is, if you touch, it will not be cold. The patient will feel that the feet are cold or this place alone is cold. These are all representations of the symptoms of sciatic nerve being compressed. So this is also one type of a slip disc. Other than that, Other sciatica is somewhere down, okay, in the lumbar and sacral region. So if you come up, also anywhere in the spinal cord, this slip disc can happen in the neck or in the upper back or in the lower back. In all these places, when there are disc collapses, radiologically you can show difference. What I call radiological difference for the layman to understand. When you take an MRI before the treatment and after the treatment, you will see a visible difference that the condition is cured. Okay. In some cases, scar tissue is formed and the patient is absolutely all right. In some cases, there is complete remission also.
Okay.
So in slip disc, for pain management and for the other symptoms that we talked about, in all these cases, we can do panchkarma along with internal medicines. And we have developed a certain technique in panchkarma where a multitude of treatments will be given together according to each person. The treatment protocol will slightly differ, but within 8 days, daily, maybe 1 hour to 2 hours of treatment. Mostly it is a 1 hour treatment. It is a OPD based treatment. It is a day care treatment. You can come, get your treatment done, go back home. You don't have to stay in the hospital, which means essentially in 8 hours, right? Daily 1 hour, 8 days you do the treatment. Essentially in 8 hours, you are able to give a pain relief of up to 70 to 80% in any type of slip discs. Other than this, yes, sometimes you have to repeat this panchkarma 2-3 times, maybe monthly once for 8 days, depending upon the severity of the condition, and then the internal medicines will also, you will keep continuing that. So yes, in slip discs, we have amazing treatments. It can be a neck related problem which is radiating to the hand. It can be other problems like having a rotator cuff problem, or it can be what they call a frozen shoulder colloquially, or other joint disorders also. Yes, Ayurveda medication, pain management is really good.
In this episode, we have seen treatments available in Ayurveda for many commonest conditions. I hope this will useful to you, and thank you, sir. It was nice to have you here, and looking forward to have you again.
Thank you, Dr. Gayatri. I was very happy that I was able to share whatever I know about Ayurveda here today. Hope to meet you soon. Thank you.